for your patience while we got everything connected today. This is Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. I'm going to take just a moment to click buttons to make sure that all the media have permission to record. You will have permission to record this briefing, and we are also recording, and we'll post that on the Health District's YouTube page and website later today. So give me just a moment. Okay, I think I've given everybody permission to record. If you run into any issues, please send a chat to the Joint Information Center and we will get that fixed. We're joined this morning by Snohomish County Executive Dave Summers and Snohomish Health District Health Officer Dr. Chris Spitters. Each of them will share a few remarks, and after they're finished, we'll take questions using the chat feature. Please make sure to submit your questions to everyone so that all of our speakers can see. Thank you again for joining us, and with that, I will turn it over to Executive Summers.
Well, thank you, Heather, and good morning, everybody. I just wanted to spend a couple of minutes talking about vaccine mandates this morning. So as you all know, the federal government announced a mandate for vaccines and testing. And while it explicitly covered businesses with over 100 employees, we are expecting the State Department of Labor and Industries to extend that federal mandate to all organizations, not just businesses, including local governments with over 100 employees. So labor and industries can make more rigorous requirements than OSHA or the federal requirements, but they can't make one that is less restrictive. So the federal mandate included a testing option, vaccination or a testing option. We're expecting state labor and industries to mirror the state mandate announced earlier that did not include a testing option. So we're currently awaiting the federal OSHA rules, and then in turn, labor and industry's interpretation of those rules. So as soon as we know the details of the mandate, we will be communicating to those to our employees, and let you know also. Since over 70% of our employees are already vaccinated, we don't have a great deal further to go, pretty good shape, but this will certainly cause some additional requirements. So with that, I'll hand it up to Snohomish Health District Officer, Dr. Chris Spitters. Thank you.
Right. Thank you, Executive Summers. Good morning, everyone. So let's do our usual weekly update on the COVID numbers. We're relieved to see our case count having decreased again slightly last week, down the number of cases reported in Snohomish County last week, Sunday through Monday, was 1,750. About a 14% decline from the 2,020 or so that were reported the prior week. Adding those two past weeks together gives us a rate of 447 cases per 100,000 residents for the 14-day period ending September 18. So while we're seeing a slight decline in that rate off of the peak, and maybe we're coming down the other side of this, we are still at a very high level of transmission. Although the change in direction is reassuring and hopeful, we are far from out of the woods, and this is not cause for celebration. I also want to mention, in follow-up to Executive Summers' comment about vaccination, just again to give you an idea of the importance and the value of vaccination. Up through the end of, for the month of August, the rate I just mentioned to you, our recent rates have been around 400 per 100,000. The rate in the unvaccinated in Snohomish County for the month of August was 800 per 100,000, and in the vaccinated was 200 per 100,000. So a 75% reduction in risk for the vaccinated individuals. Similarly, hospitalizations, 25 per 100,000 for the month of August in the unvaccinated, and 5 per 100,000 in the vaccinated. So an 80% reduction in risk there. So just more reason to seek the benefits of vaccination for those of you who have not done so. We still had 1,700 residents test positive for COVID last week. For every confirmed case, there's an additional number of people identified as close contacts who then have to quarantine. That included 1,000 K through 12 students in the county who were quarantined last week. So we've got thousands of people missing work, school, and other commitments today and this week because of the ongoing transmission of COVID in the community. So while the rates are down slightly, we still have this extremely large number of people infected, in quarantine, and also hospitalized. As of this morning, there are still 102 Snohomish County hospital beds filled with COVID inpatients. 15 are on ventilators. Those numbers are slightly lower, but not substantially different from last week. And the stress that the acute care hospital system and the rest of the healthcare system remains under has not changed substantially since we last spoke. We've also been seeing a steady increase in the number of COVID deaths. There were at least 34 in August and another 16 in the first 2 weeks of September. Those last 2 weeks, very preliminary because the death data gets resolved over the course of a couple of weeks. So although these numbers of deaths as a proportion of the total number of cases are down substantially compared to the prior big waves, like wave number 1, wave number 3, for this amount of disease and hospitalization, we would have seen many more deaths. And again, that's the vaccination preventing people from experiencing severe disease and death. But we still are seeing a bump in deaths as another signal of the ongoing transmission of COVID-19, which is real and far-reaching. These impacts, I think everyone's feeling it, from the healthcare system to government to businesses, students, families. Sustained levels of transmission like this or ongoing levels of transmission like this are not sustainable. And your efforts to mask up, keep your distance, get vaccinated, and stay home if sick are our toolbox for getting down the other end of this and getting some relief to all of us, but especially to the healthcare system, and to try to help keep kids in school and keep businesses running. I'll talk a little bit about children and schools in a minute. As you may have seen in our press release last Friday, September 17, there were 367 confirmed and probable cases and more than 2,000 close contacts involving childcares, schools, and youth sports identified in the 2-week period ending Thursday, September 16. Our child care and schools team has been inundated with cases and have been working just about nonstop to support these case investigations. Unlike last year, where schools were in a remote learning environment for the vast majority of students, our focus this year is on ensuring the effectiveness of mitigation measures so that we can keep students learning in the classroom. And despite that large number, 2,000 students in quarantine, and all the efforts of the school staff and the health district staff that are involved in identifying and communicating with those students and their parents, and the impact on the students and the parents and the school system, the silver lining of that is that there are just under 200,000 K-12 students in Snohomish County. So this is roughly 1% to 2% of those students out due to COVID quarantines. That means the other 98% of students should still be in class. When cases occur among students or staff, and they will, as long as we have transmission in the community, we'll have cases popping up in schools. We work with the school to optimize the number of individuals being quarantined and try to prevent transmission in the school. From time to time, there may be a classroom or two in a school that may need to be temporarily closed if there's ongoing transmission not responsive to the mitigation measures. But those episodes won't necessarily call for any change in school-wide, district-wide, or county-wide operations. We need students, families, and teachers to continue working with us to get cases down and keep these impacts small. To help with that, the Health District has prepared a variety of resources and important reminders, including a back-to-school COVID-19 toolkit for students and families. These are all in alignment with updated recommendations released by the State Department of Health last week, and they're available online at our on our website at www.snohd.org/schools. And speaking of schools, you've likely heard the news yesterday that Pfizer announced that they had completed their phase 3 clinical trials in children and plan to submit their requests to FDA soon to expand their emergency use authorization to include 5 to 11-year-old children. This is encouraging news, and it's something many of us have been waiting for and looking forward to. However, there are still quite a few important steps ahead before parents can start thinking about getting their young children vaccinated. FDA needs to review the study data and determine whether to grant authorization for that use. Then CDC's Advisory Committee on Immunization Practices needs to review that data and make clinical recommendations for use. And finally, the Western States Scientific Safety Review Work Group then reviews it all, and state and local public health and the healthcare system have to implement the vaccine effort. So it's not time yet to call your child's healthcare provider and make an appointment, but just stay tuned while Pfizer takes the first step of submitting that application to FDA, and then we'll follow along and keep you all posted. The last reminder I have for today is around testing. Many of our healthcare partners are seeing an increased number of employers requiring their employees to come and get a negative test, before they can return to work after being positive and a confirmed case. However, this is completely unnecessary and a tremendous waste of scarce testing resources. Right now, due to the nationwide surge in COVID activity and supply chain issues for materials involved in the COVID testing, we encourage all exposed people and people with symptoms to seek testing promptly, but retesting of previously diagnosed cases for the purposes of a return to work is not helpful, and it's not necessary. Again, the rules of the road are this: after testing positive for COVID, a negative COVID test is not necessary or required for people who have not been severely ill or who are not severely immunocompromised. They just need to stay out of action for 10 days after their positive test or 10 days after their onset of symptoms. And then they can return to work and other activities, be released from isolation. I mentioned people who had severe disease or who are severely immunosuppressed. Their waiting period to get out of isolation is 21 days. So retesting, folks, just consumes healthcare staffing resources and testing equipment, but it doesn't change disease control. Just for employers out there, keep your workers out for 10 days after their diagnosis, then let them back in. They should not need a retest. It's gonna waste limited resources to keep requesting that. So with that, I'll turn it back to Executive Summers.
Thank you, Doctor. First question is, there are 2,000 K through 12 students quarantining. Does that mean they have to spend 14 days in quarantine or out of class? Parents are frustrated with that length out of class. Can quarantine time be lowered? You're on mute.
So as many of you may be aware, there are alternative options for quarantines offered, but it's at the discretion of the local health district. And right now, with Delta circulating and inability to, we're doing our best, but obviously, if you look at the numbers, they just kept going up. So we didn't want to cut off quarantine periods too short. And also, there's a great operational complication if you have 3 different lanes of quarantine criteria, and then trying to keep all the lanes straight really to operationalize a robust control and mitigation effort with the schools across 11 school districts and hundreds of schools. This is what we've got to do to make it work. We're aware of the impact on the schools and the students and the families, and the best way for us to mitigate this is to get that curve down. And I regret the individual impact that it will still remain for kids who are quarantined for 14 days. But our pathway out of this is for all eligible older kids to get vaccinated, everybody to mask up. Let's get transmission down in the community, and then these number of school cases will also go down, and the number of children being quarantined will go down.
Okay, next question. How is the county doing in terms of those limited testing supplies and the supply chain, keeping them coming so we can maintain the current testing effort? How are we doing on that, Doctor?
Well, I think, we're able to submit all our tests to the state and get our results. And so that part's going well. I know some of our private healthcare system partners have had some trouble and had to try to redirect some of their specimens through other labs because they're, maybe out of reagents, the chemicals for the machine that they have. But it's holding together. We're still doing 15 to 20,000 tests per week. But further stressing it with unnecessary employment-based testing for when the time to return to work can just be based on a matter of time, not a test, it is the point we're trying to make this morning.
Okay. You aware of any childcare facilities closed due to COVID?
I am not. It's possible there might have been one that I'm not aware of, but nothing large or major. And I think the answer is there are none.
Okay, with a slight decline in cases, yet an increase in deaths, are death rates reducing hospital capacity simply because patients are dying?
Oh. I'm having
I think that's, the question goes to ICUs and people kind of
right.
severely ill. And my understanding that's still a challenge for hospitals.
Oh, yeah. The number of deaths compared to the number of people in the hospital, there's roughly 100 to 110 people in Snohomish County hospitals with COVID, and each day, 1 to 2 are dying. So while that's a sad thing, especially for the families and the patients themselves, it offers no relief to the hospital system.
Do you believe the recent declines in the new case numbers and rates are the start of what might be a sustained downward trend?
I hope so. And it's all of our job to carry that momentum with us and keep masked up, spread out, avoid gatherings. And if you're not vaccinated, get vaccinated.
Yeah, I'm obviously not a doctor, but we have seen a double spike before in one of the earlier peaks that we sort of hit a peak, declined for a couple of weeks, and then went back up again. So I think now we're all just taking a wait and see, and we're hopeful, but I don't think we can count on anything at this point. Let's see. For months we've heard the mantra: masks, social distancing, vaccines, yet we are not moving the needle very fast. How can the county take a more aggressive approach?
Well, I think this speaks to the transmissibility of the Delta strain, and quite over time, I think we're seeing that the relative effectiveness of the vaccine in preventing infection has declined, either with time and or due to the Delta strain itself. And so, part of it is we're fighting against nature, and this virus is putting up a good fight. And then, we may need, time will tell, but as things roll forward, There may be additional groups for whom a booster is recommended in addition to the groups that the FDA authorized extension of a booster dose to last week. That was folks over 65, healthcare workers, other people in high-risk occupations. I think we may see more expansion of that over time, and so that will help. But right now we're in a battle with this virus, and what we really need is everybody to mask up in public, everybody who's eligible for a vaccine to get vaccinated, and we will get through this. But I think we're all trying to do everything we can.
Just a couple of thoughts for me. I think the ability of the Delta virus to infect people, even if they're vaccinated, a little bit of a surprise to me, and Doctor, you can comment on that, but I think that was not expected, although it's very, very clear that being vaccinated provides great protection for getting seriously ill or dying. So, but we still have a substantial number of the population that have not been vaccinated and are not wearing masks. And it's certainly enough of a population to allow the continued spread also and lead to the illness and deaths we've seen. So there's a couple things going on there, but those basic safety measures with masks and social distancing vaccines are still valid. They're still helpful. They're not a total solution, but we would certainly be in an even worse place if we did not employ those. And Doctor, did I say anything out of line?
No, I think you nailed it. And again, just to accent what you were saying, recall, I think it was 2 weeks ago when Dr. Cook was on with us and noted that in the month of August, intensive care unit admissions at Providence numbered 72, 71 of whom were unvaccinated. So just one fully vaccinated person admitted to Providence ICU in the month of August. So again, although we're seeing breakthrough infections, they tend to be milder, not exclusively. There are still hospitalizations, but we don't see the severe disease with intensive care unit admission or death. Good reason to get vaccinated, even though we're seeing some decline in the effectiveness in preventing infection. But we've all got to view this, as Executive Summers suggested, it's like that, layers of Swiss cheese. Each one of these interventions has its limitations. None are perfect, but if we stack them all together, it makes it very hard for the virus to get through. And so we all need to be lining up those pieces of Swiss cheese in our lives. 100%. That's what we really need, is a full societal commitment to this effort.
Could you further explain what may be coming from L&I in vaccination requirements in places of 100 people or more? And I'll start on this. The state had imposed some vaccination requirements for larger gatherings earlier this summer, and it did not include, and for their own employees and contractors, and it did not include an option of either being vaccinated or getting tested. It was a vaccination requirement. So that's the model the state has already deployed for its own workers. The federal mandate coming down was for businesses 100 employees or over. But because we're an OSHA state, we have already in the past adopted OSHA or stronger. We are expecting L&I to take those federal rules, apply them to not just businesses, but local governments and any organization of 100 employees or more, and do so without the testing option. So we're expecting a mandate at Snohomish County for our organization, because we certainly have more than 100 employees, and we're anticipating that there will not be an option for just testing, letting people off the hook. So that's our expectation. So the overall rules flow down from the federal government. The state can adopt or adopt something stronger. They cannot adopt something weaker. We're expecting they're going to adopt something a little stronger, and so that very soon we will be under a vaccination mandate for our organization. I hope that explains it. Doctor, is that consistent with your understanding?
Yes, and I have nothing to add other than to say I think it's the last question we talk about what can we do to strengthen our response to this. Well, that's one of the things. So as the local health officer, I'm very supportive of anything we can do to raise vaccination coverage in the county.
Yeah, and one other thing, the federal mandate, we're still awaiting the rules to come out of OSHA. The general mandate proclamation has come out, but the detailed rules on how that'll be implemented has not come out. And then, also we have not seen detailed rules in response by the state to the federal mandate. So there's more information to come on that, but that's where we see it headed.
Yeah. If I can add, I think, so I don't know the timeline on it either, but assuming that sequence plays out, which I have every reason to believe it will, that means all employers with 100 or more employees need to start thinking about how they're going to implement this. So that should be on everybody's checklist.
All right, can you tell us the current percentages of the population who are fully vaccinated? Doctor, do we have percentages for the county?
It's in the high 50s. I think like 58% of the total county population is vaccinated, and 70. I'll look it up in a moment, but I think it's like 72, 71, 72% of individuals over age 12.
Let's see. You say 70% of the county employees are vaccinated. That still leaves a third not vaccinated. With the new state rules coming to mandate vaccines, how many staffers do you think we will still refuse and thus lose their jobs? So we are hearing from our departments and from other agencies, law enforcement, first responders. There's a significant number of people who are saying they will not get vaccinated and would rather lose their jobs. So we are expecting to see some of that resistance. We will work with everybody to give them access to vaccines. I don't have an estimate for you. I will say it's not zero. It's what I would call significant part of the workforce. So stay tuned on that. We're just going to have to see as we get closer and actually start implementing what we haven't, but we do expect to lose some people due to this. Let's see, what are your thoughts about the news from J&J about the effectiveness of 2 doses of their vaccine?
Great news. Great news. So we just, as usual, now we just need to see that scientific information vetted by the FDA for I presume they'll pursue something to get authorization to offer a second dose, and then that'll have to be reviewed by the CDC's advisory committee again. And then if they get the authorization and a clinical recommendation, which again, that sequence is based not just on what does the vaccine do in a clinical trial, but CDC has to take a broader look of, what's the overall public health impact, what's the benefit versus risk, and then they generate recommendations based on that. So there's still many steps to go with that, and with the young children's vaccination with Pfizer, and I suppose ultimately with Moderna. So that's, these agencies are all moving as fast as they can along with the vaccine producers, but these things do take time. But it's always good news to hear that there's an additional dose of the vaccine increases effectiveness.
Just going back to staffers who will refuse, it's one of the unfortunate things about this whole pandemic that continue to see just loads of misinformation and misunderstanding and fear about the vaccine that's driving a lot of people's decisions. And it's really unfortunate because we've got great experience now with these vaccines. They are safe, they are effective, their way out, and for folks to still be sort of getting their information off the internet and just kind of crazy stuff. It's really unfortunate. Not only are we going to lose employees, but we're losing people. As we've heard today, we're, a person or more a day in Snohomish County is dying from this thing. So it's, we're just going to try to put out the best information we can, keep reassuring people, make accommodations so our employees can get vaccinated. But that's the path forward.
Yeah, I can't emphasize enough the importance of, avoiding hearsay on social media as a source of information for health, whether it's COVID or, other health matters. Look to CDC, Washington State Department of Health, the Health District, reputable academic sites, University of Washington. But be careful about what you see on Instagram and Facebook. Check your sources. If it sounds unbelievable, it probably is.
That's it.
All right. This is Heather in the Joint Information Center. I want to thank everybody for joining us today. We're going to go ahead and wrap up, but please stay tuned for future meet availabilities. Thank you.